And how is your oldest sister doing today? How's mother?
She is, well, when you see the film, she's so incredible. She's such a wonderful, loving human being. I think she comes off better than anybody in the film because she's just sweet. She's just sweet. She's funny, and and that's not me making fun of the fact that she's she's a little bit crazy. She's so beautiful. She's got such a good heart. She's on medication, and it seems to balance her brain. She's on lithium, and she's on a truckload of pharmaceuticals. But she is such an exquisite person, and she handles her life. I mean, she doesn't handle it alone. She lives in a home, but she is cared for, and she is loved by the woman that cares for her and some other people that suffer like she does. I would love to see bigger change. I'd love to be able to take her into my own home and take care of her and change her lifestyle and see if it made a difference in some way. But I don't have the ability to do that yet. And it's new for me to be accepting of her condition in a real way. So, and that was something that happens in the film. It's kind of a journey of like going to see her where I would avoid it for months and months and months at a time.
Mm. And so, as part of your journey, were you ever involved in substance abuse, use, dependence, anything? Did you do anything?
Well, I didn't do drugs, and I never drank, but I was addicted to eating different ways, following gurus, following any kind of healthcare professional. I really believed that there was somebody outside myself, somebody somewhere that was going to solve all my problems, and I was on a search. I went the world over looking for that somebody that was going to fix me. And it took me, and it's really why I cried at 50. Now I'm 51. I'm just over it already. But
wait till you're 60.
Oh, see, I have so much to look forward to. But I really think the reason why I cried is because it was such a long. I just followed everybody. I just thought somebody had an answer for me, and then when I realized that I had my own answers, when I realized I was my own healer, when I realized I was my own therapist. Now, this is not like, I'm not saying this in a prescriptive way. I'm not saying this as a doctor, like this is what you need to do. But when I realized that I was able to understand myself and that I had the answers for myself inside of me if I got still. So it's why I wrote this book, Running with Nature, with my partner Bobby Williams, because I really believe that piece has a huge effect on us. How we live our everyday lives, the simple decisions we make every day affect us profoundly, and we don't think that they do, and they do. So, I don't know. What did you ask?
I don't know, let me think. So, did you ever feel like you ever did anything in excess besides caffeine?
Everything. I did everything in excess. I thought that I was being healthy by, I think I said it in the clip, I've been raw, I've been vegan, I ate fruit for a year, I drank coffee, and I ate air-popped popcorn for a year. I just did weird things. I ate no fat, I ate all fat. I was on a mission to figure it out. I don't know what I was figuring out, but I had issues. So if that's an excess, yes, of course. I was obsessive, I was OCD, I was crazy.
What about exercise?
I over-exercised like crazy. I drank too much coffee at the same time. I raised my kids over-caffeinated, but it was organic coffee, so it was healthy for them. I raised my kids over-caffeinated and eating like fruit. So I was like on sugar and caffeine and thinking that I was like balanced. And no wonder I was depressed. I was a little bit edgy.
He needed some protein. So tell us a little bit about your kids.
My girls are wonderful. You saw a little bit of one of my girls who's in the film, and she's just such a cool kid. She's like awesome. Her name's Langley. She lives here in Los Angeles. She's an artist, and she's a model. And she's just doing really, really well. And she was the one I was a little bit worried about. She had some times in college where she was depressed, and I worried. And I worried even as a little, when she was little, because she was the only one that was really, you know, she had those quiet times that I was like, you know, where's that going? And she's doing extremely well. We have a very open and great relationship. She watched the movie with me, and she didn't know half the stuff about my family that was revealed in it. And she was blown away and was just awesome about it. My oldest daughter, who's 25, lives in New York City. She's an actress. She did a film this last year called Starlet, got really rave reviews. She's also a model, and she's an incredible human being as well. And they are, you know, it took me a while. I didn't, and I say it a little bit in that clip, I didn't say a lot about my family. I didn't talk about mental illness. I didn't talk about my own problems, trying to look like everything was cool. And that has changed, and we have such an open dialogue about all of these kinds of things, and I think that's extremely important. I think parenting from a place of honesty and openness about your own journey is super, super important. Of course, I thought I was being honest about it, but in retrospect, you know, there was a lot of things that I just wouldn't talk about or deal with.
Do you worry about her being in New York City and being in that industry?
I gotta tell you, I don't know, maybe it's a generation. I was such a dork when I was in New York living there back in the day, and so shy, and like I think back and I worry about me. Then I'm like, wow, I'm worried about my history. I'm worried about how I dealt with things. My daughters are strong girls, which is wonderful. I mean, there's something to be said for the generation now, is that they're very honest, they're very open, and I think, or maybe it's because I am now more honest and open about my life, but they're very strong girls. I don't worry about them. You know, you can't pull any crap on them.
And do you find that the media has changed? You know, we talked about your grandfather. How long did it take before it was brought out that he had committed suicide, since it was under wraps for so long?
It took a long time. I think it was a very long time. I can't remember the exact the exact date, but I think it was several years afterwards that it was actually revealed that, you know, explicitly that it was suicide.
And how long, so with Margot, and you saying this at this dinner, did the media pick up on that immediately?
Well, you know, here's the great joke about that, is that the media, it was already suicide. It was that my family wasn't accepting it. So the media, when my sister died, they talked about suicide and they did the whole thing, and my dad just turned his head, and because he turned his head, we all turned our head, and we all said it didn't happen. And we just pretended, we didn't look at the news, we just pretended it didn't happen. And that's very interesting. I mean, what an interesting thing to say about mental illness and suicide, is that we don't, I mean, at that level, when it's in your face and the media is telling you that it's happening, that's an interesting statement.
And do you think that the media has changed now? Do you think that we are more open about it and talking about it?
Yes and no, and I think that this is what this is about. You know, we're here talking about it. We're here as people that probably have some relationship to it, and I actually think everybody has a relationship to mental illness or something. So, and if we can take this small group of people and we can take this out and speak more about it, that's what does it. And it's not about Mariel Hemingway talking about it. It's about you talking about it, because I reminded you that you can.
Yeah, that's what somebody said yesterday, was that after having been at this event, you gave her permission to be who she was, which I think is just huge. And Dr. Sheener, I wanted to ask you, one of the tenets, one of the components of Proposition 63 is prevention and early intervention. And this is something that, is really, this is what Darrell Steinberg, the Senate Pro Tem, when he authored this was what he was very excited about, was to be able to offer this. How has that changed mental health services?
Well, I think that as part of prevention, early intervention, we've begun to have a dialogue and also be able to have services that we can provide that hopefully do prevention and early intervention. what do we actually do about it? It's a very complex social, societal problem. And luckily there's bureaucrats who can take very complex social problems and take them and transform them into very complex policy statements. So, and one of them that helps guide it, and of course, the ultimate bureaucracy is a national level. We're amateurish at the local level. But at the national level, we've begun to focus on suicide prevention across the country. And in fact, last year was the suicide prevention strategies. There may be a better bureaucrat here who remembers the exact name of that paper. But the Surgeon General came out after 10 years or more since the last one and had a national strategy for suicide prevention. And as I recall, there were 4 components to it. The first one was to create what they called an environment where you can talk about this, because there just hasn't been that kind of national environment. And as Mariel said, that's a lot of what tonight is about, and what Prop 63 has enabled. That's the first one. The second part was of the 4-part national strategy was to have prevention and early intervention, to be able to develop suicide prevention, not only programs, but full networks. For instance, with Prop 63, we have one for all of California, and the Hirsch is a big part of that, not just locally, but throughout California. The last part, a little bit, I hate to say it, a little bit more problematic. 2 more, good treatment and outcomes. So it is good to talk about this. It's good to reach out to find people. But then you like to think that if we could then bring them in, we can truly help. Do we do that? I have to just tell you one of the things about being a bureaucrat in the Department of Mental Health and a clinician is that we see all the suicides that have happened throughout each year. And in the Department of Mental Health, we have about, for suicides that we know that are clearly suicide, it comes as an incident report. There are somewhere between 25 and 30 per year. Now, there's a lot more than that out there, but these are the ones that are clearly documented, and they're a special group. They were not just people out there that, for whatever reason, whether it was lack of, I don't know, a truckload of pharmaceuticals or fruit or whatever it was, it wasn't that. These were people that came for help, and we blew it. It's a very difficult thing. It's difficult for a system, it's difficult for clinicians, but it also provides perhaps some clues as to what we have to do and what we can do better. So I couldn't go through all 25, but I'll tell you a couple of just themes in terms of what we can do better. Here's the first one. None of these are good. Each of these 25 is like, it's a gripping story with a very bad ending. But here's one. Someone calls and says they have suicidal thoughts. They talk maybe on the phone about it, or even at initial appointment. We are deeply empathic. We tell them this is a good thing that you sought help. But you know, you live in this part of the valley, and the proper clinic is on that side. So you need to go over here. We have a lot to learn about taking fragile people and making sure that they can navigate a system and get access. Another thing Prop 63 is allowed is to have what we call system navigators, not to just get people who then reach out, but once they do reach out, to be able to help them navigate a very complex system and get to the right place. That's one. One second one, so we have somebody that's in treatment. They are depressed. They've said lots of terrible things. It's very carefully documented in the clinical work. You can read it. and then they kill themselves. And you look back at the record, and one's tempted to look at the collisions and go, so what is it that you needed to know? And what we found is that while there's lots of ways to assess and think about suicide and who might be capable of it, what we really need are better instruments, things that people can, as a clinician is talking to someone. There are suicide assessment scales. There's one called the Columbia Suicide Severity Rating Scale that we're considering piloting in DMH, where we can actually get objective measures of how likely someone might be and how much protection that they need. So it's not just a clinician either understanding, or maybe even like the rest of us, pushing it away and not wanting to deal fully with it, so that we can get people into the right level of care quickly.
I have to jump in because I think Prop 63 has supported a lot, and a lot of preventive measures, and I think there's also a lot of innovation going on, especially in California. And for example, we've been doing pilot with several emergency rooms because we know that if someone goes to the emergency room after making an attempt, if they are followed immediately, they are far less likely to take their lives. The risk of taking your life in the few weeks after you've been to the emergency room are very high. And so that's one of the things we're doing. We're doing chats because kids these days don't necessarily want to even call. And so finding the right way to communicate with people, and even on our crisis line, the myth was that crisis lines are middle-aged ladies that just want to whine and moan. And the truth is we have about 50% men calling us, and we do an assessment that came out of university research, and now in California, the crisis lines, we're using common measures, and if you're part of the National Suicide Hotline, we're all using a very effective scale to assess risk, because that's one of the problems. People are afraid to ask the question, are you thinking of killing yourself? And if we don't ask, and then we don't say, and how would you do it? And do you have a gun? So I do think that a lot is changing, and I'm not as despondent as you are. The one thing that you mentioned, the media, is that, and this was sponsored by Prop 63, was a study of how the media is handling suicide. And the media is much better about not sensationalizing, which can lead to copycats. But what they're not doing, and we've had this happen, they'll call and they'll interview us and they'll say, please put the number of the hotline, put resources in there. And they go, oh yes, we look at the media and say this is their media guidelines, and it was just so frustrating when you talk about the issue and you don't give people any resources, and they don't put it in. And so now they're studying if the media is going to get any better at that. But
yeah, we'll see. We'll see. And also, speaking of which, these bracelets are out there for you to take with you. What are these bracelets? Tell us.
Well, these have the number of the suicide crisis line, Dee Hirsch's crisis line, and you can call it really from anywhere in California or the United States, and it's toll free. There is a national line too, but so 24 hours a day. We have Spanish language 24 hours a day as well as English, and we now, Lynn Morris, who's been the director of our Suicide Prevention Center for 8 years, how much Korean and Vietnamese do we have now?
Korean, we have 8 hours.
So every night at the peak hours, for 8 hours, we have Korean and
Vietnamese are building up, but right now we have about 25 to 30 hours.
so about 25, 30 hours. So really, because the other important thing about resources is we can be agents of change. There aren't enough therapists out there. And so if we know how to ask and we know how to connect someone, so it's really important that people know they can call the crisis line and say, I'm worried about someone, I don't know what to do. Is it okay to bring it up, or am I going to put an idea in their head, which is a myth? So the more that we get the resources out to the community, we will all be agents of change.
So Mariel, before we go, give us the takeaway. Tell us what we all need to do. What if we were, for example, to when I asked you what's your lifestyle like? What do you include in it? You look absolutely fabulous. You sound fantastic. Tell us what we need to do, sister.
Wow. That's a big question because I've spent a lifetime trying to figure that out. Well, okay, buy my book. No.
Oh.
To be honest, I think that when people start to look at their lives from the perspective that it's their lives, it's their journey, it's their adventure, I say get excited about living your life. Because Bobby and I didn't write the book because we have so much great information that you have to do. We want to inspire you to write the book of your life. We want to inspire people to find that greatness in that. Because we already believe, and I believe when I look out into the faces of everybody, I already believe that you're great human beings. We're all wonderful. We all have our beauty. We all have our perfect bodies. We all have the dream job. We all have what we're meant to do inside of us. And sometimes we just need a little bit of help to find our way to that place of our joy. And it looks different for everybody. There's not one size fits all to the right life for any particular human. It is your specific journey. And to know that your life is so unique and beautiful and wonderful and so you. And that's what I feel that I want to inspire people to get excited about figuring out the life that they can wear like the most beautiful suit or dress or something that fits them beautifully like a glove that is sensual and wonderful and just enhances their wonder and life. And like I said in this thing, it took me so long, but I found the life that works for me. And it was a long journey finding it. But I know that it's possible for everybody to live their dream. And I don't mean, it's not about like, oh, I don't like my job and I'm going to find another job. It's about seeing what you have and really accepting it and seeing it as part of your path. Maybe you have to shift some things, but to really embrace where you are in your life so that you can get to where you want to go. Because all of our dreams are doable and attainable. I know it because I have found them. And it's not because, oh, I came to the end of my life and I have $1 billion and I never have to work again and blah, blah, blah. And it's not that I'm never sad. It's not that I'm never depressed. It's not that I'm never anything. I'm a human being who suffers from all the things that everybody does. I have fights with my boyfriend. I deal with my children. I have issues. I get stressed out. I'm anxious. But it's the way that I respond and not react to those things. And that's the beauty of living a life that you love, is having response rather than reaction. Living your life from a place of taking a breath, taking time, taking stillness, taking time for you to feel you. I spent too many years not wanting to feel what I really felt. And now I embrace it. Now I walk into it knowing sometimes it might be scary, but I always know that at the other side of it, I'm going to learn something more about myself. And if there was anything I could give anyone, it's just to say, I already know that you're great, and I wish you knew. And that's all I would want to say, is inspire you to find you.
That's awesome. And on that note, I want to thank Dr. Roderick Shaner from Los Angeles County Department of Mental Health. Thank you so much. And Dr. Peter Curry, thank you so much from the Hirsch Mental Health Services. And a huge, huge thank you goes to Mariel Hemingway for sharing her story with us and for this conversation tonight. Thank you so much. And one final note about Prop 63, unless you're a millionaire, you're not paying for it. It's a millionaire's tax. So thank you, millionaires everywhere in California. Thank you so much for coming. Have a great evening. There's some handouts for you out there on the table. Also, there is a radio show called For Your Mind Projects. It's on the weekends. There's a flyer on that as well.